3 minutes from now, somewhere in the world, a human brain will begin to die, not because of an accident, not because of violence, but because a tiny blood vessel inside the skull silently fails. And what makes this terrifying is that in many cases, the body already tried to warn them. A strange numbness in one hand, a sudden moment of blurred vision, a few seconds where words refused to come out correctly, a wave of dizziness so intense they had to grab the wall. Then it disappeared. And because it disappeared, they ignored it. Most people imagine stroke as something instantaneous. You are healthy one moment, collapsed on the floor the next. But the truth is far more disturbing. For many people, stroke does not begin on the day of the emergency. It begins years earlier, inside blood vessels slowly being damaged in silence. And before the final collapse, the brain often sends desperate warning signals. The frightening part? Most people never recognize them. They blame stress, fatigue, low blood pressure, poor sleep, too much phone use, or simply getting older. And while they continue living normally, a clot may already be forming, an artery may already be narrowing, a section of the brain may already be starving for oxygen. Tonight, we are going to uncover what those warning signs really mean. Why temporary symptoms can predict permanent brain damage. Why some strokes happen during sleep just before dawn. Why a few lost minutes can permanently destroy speech, memory, movement, or personality. And perhaps most importantly, how many strokes could actually be prevented if people recognize the signals early enough? Because once brain cells die, most of them never return. Every minute matters. Every ignored symptom matters. Every delay matters. And somewhere during this video, you may recognize a symptom you once had yourself, or something that happened to someone you love. This is not just another health discussion. This is knowledge that could one day help save a life, maybe even your own. So before we begin, take a second to like this video, subscribe to the channel, and turn on notifications, not just to support the channel, but because understanding how the body warns us before disaster strikes may become one of the most important things you ever learn. Now, let's begin. There is a terrifying reality happening around you right now, and most people never notice it until it is already too late. Somewhere on Earth, every roughly 40 seconds, another human being suffers a stroke. Right now, while you are listening to these words, another brain is losing oxygen. Another family is hearing a phone call that changes their entire life. Another person who felt completely normal a few hours ago is suddenly unable to speak, unable to move, unable to recognize the face of someone they love. And here's the frightening part. In many of those cases, the body already sent warnings beforehand, not vague warnings, not mysterious signs, very specific neurological alarms, sometimes several hours earlier, sometimes several days earlier, but people ignored them. Tonight, we are going to uncover something most people never fully understand about stroke. Why does the brain often warn us before disaster strikes? Why do so many people mistake those warnings for harmless fatigue, dizziness, stress, or low blood pressure? And perhaps most importantly, what exactly is happening silently inside the blood vessels years before the stroke finally appears? Keep those 3 questions in your mind, because the answers connect together like pieces of a hidden puzzle. And once you see the full picture, you may never look at headaches, dizziness, numbness, or temporary vision problems the same way again. What makes stroke especially dangerous is not only how deadly it is, but how deceptive it can be. Most people imagine stroke as a dramatic event, a person suddenly collapsing to the floor, a face becoming twisted, an ambulance rushing through traffic, a frantic race against time. But the truth is often much quieter, much slower, much more silent. For years, the blood vessels inside the brain may already be under attack. Tiny injuries, tiny inflammatory reactions, tiny interruptions in blood flow, day after day, month after month, year after year. And during all of that time, the body tries to communicate. The brain whispers first, before it finally screams. The problem is that modern life trains people to ignore those whispers. You feel dizzy. You say you are tired. You feel numbness in one arm. You assume you slept in the wrong position. Your speech briefly feels strange. You blame stress. Your vision darkens for a few seconds. You think you looked at your phone screen too long, and then the symptom disappears. So you move on with your day. But what if those few seconds were not random at all? What if they were the final warning before permanent brain damage? In many Asian cultures, including Vietnam, there are common explanations people use when strange neurological symptoms appear. People may say the body has been exposed to wind, or the circulation is weak, or the person worked too hard, or their blood pressure dropped temporarily. So instead of going to the hospital, they drink sweet water, lie down, massage the skin, apply oil, wait for the symptom to pass, and sometimes the symptom does pass, at least temporarily. That temporary recovery becomes the most dangerous illusion of all, because when the symptom disappears, people believe the danger disappeared too. But inside the brain, the underlying damage may still be progressing. Imagine an old water pipe hidden inside a wall. From the outside, everything looks normal, but inside the pipe, rust has been accumulating for years. The passage becomes narrower, the walls become weaker, small fragments begin breaking loose. At first, water still flows. Then one day, pressure changes slightly, and suddenly the pipe either bursts or becomes blocked completely. That is very similar to what happens in many strokes. The final event may seem sudden, but the destruction started long before anyone noticed. This is why stroke specialists often say something very important. Stroke is rarely a random accident. It is usually the final stage of a long biological process, a process involving inflammation, blood vessels, blood pressure, blood sugar, oxygen supply, and microscopic injuries accumulating over time. And here's something even more fascinating. The brain is extraordinarily sensitive to interruptions in blood flow, far more sensitive than most organs in the body. Your brain represents only a very small percentage of total body weight, yet it consumes an enormous amount of energy. It constantly demands oxygen. It constantly demands glucose. Every thought you have, every memory, every emotion, every movement, every heartbeat regulation, every breath, depends on billions of brain cells receiving uninterrupted fuel every second. Unlike muscle tissue, brain tissue has almost no energy reserve. It cannot simply wait very long when blood flow stops. The moment oxygen delivery is interrupted, a countdown begins. And this is where many people underestimate the seriousness of stroke. They imagine the brain can tolerate reduced circulation for a long time. But neurons are incredibly fragile. Just within minutes of severe oxygen deprivation, brain cells begin dying. And unlike skin or liver tissue, many neurons cannot regenerate once destroyed. That means a temporary interruption can leave permanent consequences. Speech problems, memory loss, paralysis, personality changes, loss of balance, difficulty swallowing, or complete dependency on other people for daily life. Sometimes the patient survives, but the person they used to be never fully returns. This is why early recognition matters so much, not only because it can save life, but because it can preserve identity itself. And yet, even with all modern medical technology, millions of people still miss the earliest warnings. Why? Because the warnings themselves are often strange, brief, intermittent, easy to rationalize. A symptom appears for 30 seconds, then disappears. A person feels slightly confused, then normal again. One side of the body tingles briefly, then recovers. The brain temporarily loses blood supply, then circulation returns. So the patient assumes nothing serious happened, but what they experienced may actually have been the beginning of a vascular emergency. And this leads us back to the first big question we opened earlier. Why does the brain sometimes send warnings before a major stroke? The answer lies in how blood vessels fail. Most blockages do not happen instantly. They evolve gradually. Inside arteries, fatty plaques can slowly accumulate along vessel walls. Over time, the channel carrying blood becomes narrower. The flow becomes unstable. Tiny clots may temporarily form and dissolve. Small fragments may briefly obstruct circulation before moving away again. For short periods, parts of the brain receive insufficient oxygen. The affected region temporarily malfunctions. Then blood flow returns. Symptoms vanish. Doctors call these episodes transient ischemic attacks, or TIAs. Many people casually describe them as mini strokes. But that phrase can actually be misleading because there is nothing mini about the warning. A transient ischemic attack is often the brain's final alarm before catastrophe. The terrifying part is that many people completely ignore it because recovery feels so fast. Imagine touching a hot stove for 1 second. You pull your hand away immediately. Pain warns you that tissue damage is happening. Now imagine if the brain had no pain receptors capable of screaming in the same direct way. Instead, it communicates through function loss, temporary blindness, temporary weakness, temporary confusion, temporary speech problems, temporary imbalance. The symptom itself is the message, and if you silence the message with denial, the underlying danger continues growing. Researchers have found that the risk of a major stroke rises dramatically after transient neurological symptoms appear, especially during the first few days. That means the period immediately after these strange brief symptoms may represent the most critical opportunity for prevention, a narrow window, where rapid medical treatment can potentially stop permanent brain damage before it happens. And yet, many patients never seek help during that window. Because human psychology is strange. People fear bad news, people delay action, people hope symptoms will never return, and perhaps most dangerously, people trust temporary improvement too much. But temporary recovery does not always mean the body is safe. Sometimes it means disaster almost happened and narrowly missed. That distinction changes everything. So as you continue listening tonight, I want you to remember those 3 questions again. Why does the brain warn us before stroke? Why do people ignore the warnings? And what silent damage is building inside blood vessels long before symptoms appear? Because the deeper we go into this topic, the more unsettling the answers become, especially when you realize that some of the most dangerous stroke symptoms do not look dramatic at all. In fact, one of the earliest warning signs can happen quietly, in complete silence, inside a single eye, that silent darkness inside one eye, that strange moment when vision briefly disappears. That may actually be one of the brain's earliest distress signals. But to truly understand why those warning signs matter so much, you first need to understand something deeper. Not all strokes happen the same way, and this is where many people become dangerously confused, because the word stroke sounds like one single disease, one single event, one single mechanism. But in reality, there are 2 major forms of stroke, and they destroy the brain in completely different ways. One happens because a blood vessel bursts open. The other happens because blood flow suddenly stops. One floods the brain with blood, the other starves the brain of oxygen. Yet both can end with the same horrifying result: brain cells dying by the millions. And the difference between these 2 forms matters enormously, not only for treatment, but for survival itself. Because a mistake in the first few minutes can sometimes make the damage even worse. This is one reason doctors become extremely careful during stroke emergencies. They do not immediately assume the cause. They must first determine which type of stroke is happening inside the skull, because the wrong treatment applied to the wrong type of stroke can become catastrophic. So tonight, as we continue opening the hidden layers of this subject, keep another question in your mind. If 2 people both appear to be having a stroke, why can one require blood-thinning treatment while the other could die from that exact same medication? The answer begins inside the blood vessels themselves. Let us start with the first major type, hemorrhagic stroke. This is the form many people fear most instinctively because it often arrives violently. Inside the brain, arteries constantly carry blood under pressure. Every heartbeat sends force through delicate vessel walls. Normally, those walls remain strong and flexible, but over many years, high blood pressure, inflammation, smoking, diabetes, and vascular damage can weaken them. Imagine slowly inflating an old garden hose every single day for decades. Tiny structural weaknesses begin forming. The walls lose elasticity. Microscopic cracks appear. Eventually, one section can no longer tolerate the pressure, and then it ruptures. When a blood vessel bursts inside the brain, blood escapes into surrounding tissue. At first glance, some people find this confusing. How can bleeding cause loss of oxygen? Is blood not supposed to help the brain? But this is where the tragedy becomes more complex. Blood only nourishes the brain when it stays inside blood vessels. Once it leaks outside, it becomes destructive. The escaped blood begins compressing nearby brain tissue. Pressure rises inside the skull, and unlike other parts of the body, the brain has very little room to expand. The skull is rigid, closed, unforgiving. So even a relatively small bleed can create enormous danger. Imagine pouring water into a sealed glass container already filled to maximum capacity. Pressure rapidly builds everywhere, Inside the brain, that pressure can crush delicate neural structures responsible for speech, movement, memory, breathing, even consciousness itself. This is why hemorrhagic strokes often have extremely high mortality rates. The damage comes from multiple directions simultaneously. The ruptured vessel stops delivering oxygen normally. Escaping blood compresses surrounding tissue. Inflammation intensifies. Pressure increases further. And if swelling continues, entire regions of the brain can become critically damaged very quickly. Sometimes patients lose consciousness within moments. Sometimes severe headache appears first. Sometimes vomiting. Sometimes sudden paralysis. Sometimes confusion so profound the person cannot understand what is happening around them. And here is another terrifying reality. The brain itself cannot feel pain directly, but the structures surrounding it can. So when people describe the worst headache of my life appearing suddenly, doctors pay very close attention, especially when the pain arrives explosively, like something ruptured internally, because sometimes something actually did. Now compare that to the second major type of stroke. Ischemic stroke. This is the most common form by far. Roughly 85% of strokes belong to this category. And unlike hemorrhagic stroke, the vessel does not burst. Instead, it becomes blocked. The danger here is not leaking blood. The danger is absence of blood. Somewhere inside the artery, a clot forms, or a fragment of plaque breaks loose, or a narrowed vessel finally closes completely. And suddenly, oxygen can no longer reach part of the brain. Imagine a city suddenly losing electricity. Traffic systems fail, communication collapses, critical infrastructure begins shutting down. That is essentially what happens inside brain tissue deprived of oxygen. Neurons are metabolically demanding cells. They consume enormous energy continuously. They cannot store large backup reserves. The moment circulation stops, the crisis begins immediately. Within seconds, electrical activity becomes unstable. Within minutes, cells begin malfunctioning. And after roughly 4 to 6 minutes of severe oxygen deprivation, irreversible cell death may begin. Think carefully about that timeline. 4 to 6 minutes, not hours, not an entire afternoon. Minutes. This is why stroke medicine is obsessed with time. Doctors often repeat a phrase that sounds simple, but carries terrifying meaning. Time is brain. Because every passing minute means more neurons dying, more networks collapsing, more permanent disability becoming likely. Researchers estimate that during a major ischemic stroke, the brain can lose millions of neurons every minute. Now imagine that process continuing while someone stays home, assuming they are merely tired, or dizzy, or stressed, or dehydrated. Suddenly, those ignored symptoms become far more frightening. And here is something many people do not realize. The symptoms of ischemic stroke depend entirely on which brain region loses blood flow. If the motor cortex becomes deprived, weakness appears. If language centers lose oxygen, speech becomes distorted. If visual regions suffer, vision changes emerge. If balance centers become affected, walking becomes unstable. The symptom is essentially a map, a clue revealing which part of the brain is under attack. And sometimes, the body briefly restores circulation before permanent damage occurs. That is the warning phase we discussed earlier. But if the blockage becomes complete, the true stroke begins. Now let us return to the question we opened earlier. Why can giving the wrong medication become deadly? Because hemorrhagic and ischemic strokes require opposite strategies. In ischemic stroke, doctors may sometimes use clot-dissolving medications to restore circulation, but imagine giving powerful blood thinners to someone whose brain vessel is already actively bleeding. The hemorrhage could expand dramatically. Pressure inside the skull could rise even faster. The outcome could become fatal. This is why brain imaging becomes critical before treatment decisions are made. Medicine cannot rely on guessing, especially during neurological emergencies. And this leads us into another important mystery. If ischemic stroke is caused by blocked blood flow, and hemorrhagic stroke is caused by ruptured vessels, why do both often originate from the same long-term vascular damage? That question is incredibly important because although the final events differ, the underlying conditions often overlap. High blood pressure damages vessel walls. Smoking damages vessel walls. Chronic inflammation damages vessel walls. High blood sugar damages vessel walls. Over years, the entire vascular system slowly becomes more fragile, more unstable, more vulnerable to both blockage and rupture. In other words, the stroke itself may appear sudden, but the biological groundwork was often being built silently for decades. And perhaps this is the most dangerous illusion of modern health. People assume feeling normal means being healthy. But blood vessel damage can progress quietly for years without pain. Plaques slowly enlarge, arteries slowly stiffen, inflammation slowly spreads, microscopic injuries slowly accumulate. Meanwhile, daily life continues normally. People go to work, drink coffee, scroll through their phones, laugh with friends, sleep, wake up, repeat the routine, completely unaware that deep inside the brain's circulation, a catastrophic event is gradually becoming more likely. And when symptoms finally appear, many people still hesitate. They wait, they hope, they negotiate with reality. Maybe it will disappear. Maybe it is stress. Maybe it is exhaustion. Maybe tomorrow will feel normal again. But stroke does not negotiate. Neurons deprived of oxygen do not patiently wait for denial to end. The countdown continues whether the patient accepts it or not. This is why early recognition changes everything. A blocked vessel caught early may sometimes be reopened. Threatened brain tissue may still survive. Functions may recover. Lives may remain intact. But once extensive brain tissue dies, medicine becomes far more limited. Rehabilitation may help. Adaptation may occur. But some losses can become permanent. And this brings us back once more to the deeper mystery underneath all of this. Why is the brain so extraordinarily vulnerable compared to other organs? Why can only a few minutes without blood permanently alter a human life? To answer that, we need to look more closely at the brain's astonishing energy demands and why this organ survives on an almost uninterrupted river of oxygen every second of every day. The human brain is one of the most extraordinary structures in the known universe, a soft organ, fragile enough to be injured by a brief interruption in blood flow, yet powerful enough to create language, music, mathematics, civilization, memory, identity, love, fear, and consciousness itself. Right now, as you listen to these words, your brain is performing trillions of microscopic operations every second. Neurons are firing, networks are communicating, memories are being accessed, meaning is being constructed from sound. Your heart is being regulated automatically, your breathing rhythm is being adjusted, your body temperature is being monitored, hormones are being balanced. Even if you are sitting completely still in a dark room, your brain is still astonishingly active. And this is exactly why stroke becomes so devastating so quickly. Because the brain is incredibly hungry. Hungry for oxygen. Hungry for glucose. Hungry for uninterrupted circulation every second of every day. Earlier, we asked a very important question. Why can only a few minutes without blood permanently change a human life? The answer begins with a strange biological paradox. The brain is relatively small compared to the rest of the body, yet its energy demands are enormous. An average adult brain weighs roughly 1.4 kilograms, only a tiny fraction of total body mass. And yet, it consumes around 20% of the body's oxygen supply and approximately 25% of circulating glucose. Think about how extraordinary that is. A small organ using roughly 1/4 of the body's available fuel. Why? Because neurons are among the most metabolically demanding cells in existence. Unlike fat tissue, unlike skin, unlike muscle at rest, neurons are constantly active, even during sleep, especially during sleep in some cases. The brain never truly shuts down. It cannot. If the heart stops receiving instructions, you die. If breathing centers stop functioning, you die. If electrical stability collapses, consciousness disappears. The brain is more like a massive city operating 24 hours a day without interruption. Traffic systems, power grids, communication towers, emergency services, data processing centers, everything functioning simultaneously. Now imagine what happens if the city suddenly loses electricity. At first, lights flicker, signals malfunction, communication becomes unstable, then transportation collapses, critical systems fail, panic spreads, and eventually, entire sections shut down permanently. That is remarkably similar to what happens during interrupted blood flow in the brain. Because unlike many other organs, the brain stores very little backup energy. This point is critically important. Most people assume the body always has reserves. Muscles can store glycogen. Fat tissue stores energy for long periods. Even during fasting, the body adapts. But neurons are different. They rely on continuous delivery, continuous oxygen, continuous glucose, continuous circulation, second after second, minute after minute, every single day of your life. And this leads to one of the most terrifying realities in stroke medicine. The brain begins suffering almost immediately when circulation fails. Not eventually, not later tonight, not tomorrow morning, immediately. Within seconds of interrupted blood flow, electrical activity changes, neurons struggle to maintain balance, communication networks begin destabilizing, and if oxygen deprivation becomes severe enough, cell death begins within minutes. This is why doctors react with such urgency during suspected stroke cases. Not because they enjoy creating panic, but because they understand something most people do not fully realize. Brain tissue has an extremely limited survival window, and here's where the story becomes even more fascinating. Many people imagine neurons dying quietly, but biologically, the process is chaotic, violent, almost like microscopic warfare. When oxygen disappears, neurons lose the ability to produce sufficient energy. Specialized ion pumps embedded in cell membranes begin failing. Electrical balance collapses. Calcium floods into cells abnormally. Toxic chemical cascades activate. Inflammation intensifies. Nearby neurons become stressed. Swelling develops, and the damage can continue spreading even after blood flow partially returns. In other words, stroke is not merely a pipe blockage problem. It becomes a chain reaction affecting entire neural ecosystems. Now remember, one of the big questions we introduced earlier. Why do some stroke symptoms appear briefly, then disappear? To answer that, you must understand something called the ischemic threshold. The brain can sometimes tolerate mildly reduced blood flow for a short period. During that stage, neurons malfunction temporarily but do not die yet. This creates warning symptoms: weakness, confusion, speech difficulty, vision changes, numbness, loss of balance. Then circulation improves again. Function returns. The patient feels normal, but underneath that temporary recovery, the vascular problem still exists. And next time, blood flow may not recover quickly enough. That is the terrifying transition from warning phase to permanent injury. And once large numbers of neurons die, the consequences can become lifelong. This is another point many people misunderstand about stroke. They assume the main danger is death. But survival itself can still carry enormous consequences. Because the brain is not a simple organ, different regions control different human abilities. One damaged area may affect speech, another may affect personality, another may affect movement, another may affect emotional regulation, another may affect memory. Some patients survive physically, yet lose the ability to recognize loved ones. Others survive, but cannot form complete sentences anymore. Others remain mentally sharp, yet become trapped inside bodies they cannot fully control. This is why neurologists often say something deeply emotional. A stroke does not only threaten life, it can threaten identity itself. And perhaps that is what makes stroke uniquely frightening. The possibility that a tiny clot, no larger than a small fragment, can permanently alter the architecture of a human mind. Now let us return to another mystery. Why does the brain consume so much oxygen compared to its size? The answer lies in how neurons communicate. Neurons use electrical impulses constantly. Every thought, every sensation, every memory retrieval requires electrochemical signaling across vast networks. Maintaining those signals requires tremendous energy, especially because the brain must remain precise. Even slight disruptions can produce major symptoms. Imagine a symphony orchestra performing an extremely complex composition. Thousands of instruments must remain synchronized. If only a few sections suddenly stop hearing the conductor, the entire performance destabilizes. That is similar to how neural networks behave when blood flow becomes insufficient. The brain depends on timing, precision, synchronization, and uninterrupted energy delivery. Now think about what happens during sleep. Most people believe the brain rests, but biologically, the brain remains highly active. Memory consolidation occurs, hormonal regulation continues, repair systems activate, dream generation emerges, autonomic control persists. This nonstop activity explains why nighttime strokes can become so dangerous, because even during sleep, the brain still requires constant circulation. It never receives permission to pause. And this brings us back again to the frightening importance of minutes. During stroke treatment, every minute matters because different regions of the brain begin crossing from dysfunction into irreversible destruction. At first, there may still be salvageable tissue. Doctors call this vulnerable region the penumbra, an area receiving reduced blood flow, but not yet completely dead. If circulation returns fast enough, some functions may recover, but if delays continue, that threatened tissue gradually dies too. This is why emergency stroke care moves with extraordinary speed. Brain scans, neurological exams, blood vessel imaging, time calculations, medication decisions. Everything becomes urgent because doctors are racing against cellular death. And yet outside hospitals, many people still wait. They sit at home hoping symptoms disappear. They search the internet. They drink water. They lie down. They delay, completely unaware that inside the skull, the survival clock is already running. This is one reason stroke awareness matters so profoundly, because recognizing symptoms early can dramatically change outcomes. A patient treated quickly may recover remarkably well. Another patient with the exact same blockage who waits too long may experience permanent disability. Minutes become destiny. Now here is something even more unsettling. The brain itself cannot directly tell you I'm losing oxygen. Instead, it communicates through malfunction. The symptom becomes the language. A numb hand, a drooping face, confused speech, blurred vision, sudden imbalance. The brain is essentially saying, something is interrupting my fuel supply. And this leads us toward one of the most important concepts in this entire discussion. Sometimes the body gives temporary warning episodes before the final stroke arrives. Brief interruptions, brief dysfunction, brief recoveries, almost like a rehearsal before catastrophe. The medical world has a name for these episodes, and understanding them may be one of the most important things a person can learn before a real stroke ever occurs. Sometimes the brain does something extraordinary before disaster happens. It sends a warning, not a vague warning, not a mysterious spiritual sign, a real biological alarm. A temporary malfunction designed to tell you that blood flow inside the brain is becoming unstable. And yet, millions of people ignore it completely because the warning disappears. The person feels strange for a few minutes, then normal again. The arm works again, speech returns, vision clears, balance improves, and the human mind immediately wants to believe the danger is over. But in many cases, that brief recovery may actually represent the final window before a major stroke. Doctors call this phenomenon a transient ischemic attack. Often shortened to TIA, the phrase sounds technical and harmless, transient, temporary, brief, but the reality behind it is anything but harmless. A transient ischemic attack is often the brain's last successful attempt to survive before permanent damage begins. And to understand why this happens, we need to travel deep inside the blood vessels supplying the brain. Imagine a major highway feeding a large city. At first, traffic flows smoothly, but over many years, debris slowly accumulates along the edges. The lanes become narrower, congestion increases, small accidents begin happening. Traffic occasionally slows to dangerous levels. Now imagine one critical section becoming almost blocked. Cars barely squeeze through. Sometimes movement stops entirely for a few seconds, then suddenly resumes again. That is remarkably similar to what happens inside narrowed arteries supplying the brain. Over years, fatty plaques develop inside blood vessel walls. Inflammation damages the inner lining. Cholesterol accumulates. Calcium deposits harden the structure. The passage carrying blood gradually becomes smaller and more unstable. At first, the brain compensates surprisingly well. Blood reroutes through alternative pathways. Circulation adapts. The person notices nothing. But eventually, the narrowing reaches a dangerous threshold. A tiny clot may temporarily form. A fragment of plaque may briefly obstruct circulation. Blood flow may suddenly drop for several seconds or minutes. And during that moment, part of the brain becomes oxygen deprived. Now, remember something crucial we discussed earlier. The brain has almost no energy reserve. Neurons depend on continuous oxygen delivery. So the moment blood flow falls below a critical level, that region begins malfunctioning, not necessarily dying yet, but malfunctioning. And the symptoms that appear depend entirely on which brain area loses circulation. If the motor cortex becomes affected, an arm may suddenly weaken. If visual pathways lose oxygen, vision may disappear temporarily. If language centers suffer, speech may become slurred or confused. If balance centers lose blood supply, walking may suddenly feel impossible. The symptom is essentially the brain crying out for help. But here is what makes transient ischemic attacks so deceptive. The blockage sometimes clears before permanent injury occurs. Blood flow resumes, neurons recover temporarily, function returns, and the patient assumes everything is fine again. This is the trap. The disappearance of symptoms creates false reassurance. People think, if it were serious, it would not have gone away. But neurologically, the opposite may be true. The temporary recovery may mean the brain narrowly escaped catastrophe, for now. And this leads us back to one of the major questions we opened earlier. Why do so many people ignore stroke warnings? Because human beings trust immediate feelings more than invisible danger. Pain that disappears feels less threatening. Weakness that improves feels less urgent. Temporary symptoms feel psychologically unreal, especially when daily life pressures continue pulling attention elsewhere. People have jobs, responsibilities, bills, family obligations. They do not want to imagine something catastrophic developing inside their brain. So denial becomes emotionally easier than action. Someone loses vision briefly while driving, then keeps driving. Someone experiences sudden numbness during dinner, then finishes eating. Someone struggles to speak clearly for 30 seconds, then laughs it off after recovering. Meanwhile, inside the arteries, the underlying disease continues progressing. And here is the terrifying part. Research has repeatedly shown that the risk of a major stroke becomes dramatically elevated shortly after a transient ischemic attack, especially during the next 72 hours. Think carefully about what that means. The body may issue a warning, then the real stroke follows only days later, sometimes hours later. This is why many neurologists consider transient ischemic attacks medical emergencies even if symptoms disappear completely, because the temporary event may represent an unstable clotting situation inside the circulation, a fragile plaque ready to rupture further, a dangerously narrowed artery on the verge of complete blockage. The brain is essentially saying, I almost lost blood supply permanently. Do something now. And yet many people never seek medical attention during this critical window. Why? Because recovery creates illusion. The person wakes up feeling normal. Speech sounds normal again. Strength returns, so they assume the episode was caused by stress, fatigue, low blood pressure, dehydration, or simply aging. But the biology underneath tells a very different story. Inside narrowed arteries, blood flow can behave unpredictably. Tiny clots may partially block circulation, then dissolve. Small fragments may travel briefly before moving away. Pressure changes can temporarily reduce oxygen delivery. These unstable dynamics create warning episodes before full vessel closure eventually occurs. And when complete blockage finally happens, the outcome becomes far more devastating. This is why transient ischemic attacks are sometimes described as rehearsal strokes. The symptoms resemble stroke because the mechanism is fundamentally similar. The key difference is duration. During a TIA, blood flow returns quickly enough to prevent widespread permanent cell death. During a major stroke, it does not. But biologically, both events originate from the same dangerous vascular instability. Now here is another reason TIAs become so dangerous psychologically. Many symptoms are subtle, not dramatic Hollywood scenes, not necessarily collapsing unconsciousness. Sometimes the person simply feels off. A sentence comes out strangely. One side of the face tingles briefly. A hand feels clumsy. Balance suddenly disappears for 30 seconds. Vision dims in one eye. Then everything returns to normal. These episodes can feel so strange and brief that patients struggle to even describe them afterward. And because they recover, they hesitate to mention the symptoms to anyone. But doctors pay very close attention to transient neurological changes, precisely because they understand what those changes may represent. Temporary interruption of blood flow to the brain is never considered normal. Never. Now let us pause and consider something deeply unsettling. Why would the brain recover at all if blood flow was interrupted? The answer lies in timing. When circulation decreases briefly, neurons begin malfunctioning rapidly, but if oxygen delivery returns soon enough, many cells can survive. Function resumes. It is almost like a power outage affecting a city temporarily. Lights go dark, traffic systems fail, communication stops. Then electricity returns before permanent infrastructure collapse occurs. But repeated outages signal that the system itself is unstable. And eventually, a failure may occur that does not reverse. This is exactly why TIAs represent such critical opportunities. They are often the final reversible stage before irreversible brain injury. Medicine still has a chance to intervene. Doctors can identify narrowed arteries, control blood pressure, manage diabetes, treat abnormal heart rhythms, reduce clotting risk, prevent full vessel occlusion, but only if the patient seeks help in time. As we have seen repeatedly, is everything in stroke medicine. Every hour matters, every minute matters. Every delay allows unstable vascular disease to continue advancing. This is also why self-treatment at home becomes so dangerous. People massage the body, drink herbal remedies, sleep it off, wait for improvement. Meanwhile, the unstable clot remains, the plaque remains, the narrowed artery remains, and the next interruption may not be temporary anymore. Now here's another fascinating detail. Not all transient ischemic attacks feel identical. Some affect movement, some affect speech, some affect vision, some affect coordination. And those differences reveal something incredibly important about the organization of the brain itself, because different regions control different functions. Which means the exact symptom often reveals which blood vessel system is becoming compromised. And one of the most frightening warning signs of all may begin with something many people dismiss as simple eye fatigue, a shadow, a curtain, a brief darkness affecting only one eye. Imagine this happening to you. You are walking outside on a completely ordinary day. Nothing feels unusual. You check your phone, you cross the street, you look at a familiar building, and suddenly, one eye goes dark. Not blurry, not slightly dim, dark. Almost as if someone pulled a black curtain downward across one side of your vision. For a few terrifying seconds, you cannot see clearly through that eye at all. Then just as suddenly, the darkness disappears. Vision returns. Everything seems normal again. Your first reaction might not be fear. In fact, most people immediately search for harmless explanations. Maybe I am exhausted. Maybe I stared at screens too long. Maybe my blood pressure dropped for a moment. Maybe I stood up too quickly. Maybe my eyes are just tired. And because the vision comes back, most people continue their day without another thought. But what if that brief darkness was not an eye problem at all? What if it was actually a warning from the blood vessels leading directly toward the brain? Tonight, we are going deeper into one of the most overlooked stroke warning signs in medicine: temporary loss of vision in one eye. A symptom many people dismiss. Yet neurologists often treat with extreme seriousness, because in some cases, that brief visual blackout is not random fatigue. It is a tiny clot moving through the vascular system. And the truly frightening part is this: the next blockage may not stop at the eye. It may continue directly into the brain. Now think back to the questions we have been building throughout this discussion. Why does the body sometimes warn us before catastrophic stroke? Why do people ignore those warnings? And what silent vascular damage allows these events to happen in the first place? This symptom connects to all three questions at once. To understand why, we need to look carefully at how the eye is connected to the brain. Most people think of the eyes as separate organs, but neurologically, the eyes are deeply connected extensions of the central nervous system. The retina at the back of the eye is packed with highly specialized nerve tissue. And just like the brain, that tissue depends on constant blood flow and oxygen delivery. The retina is extraordinarily sensitive to circulation problems. Even short interruptions can produce dramatic symptoms almost immediately. Blood reaches the eye through arteries branching from the same major vascular system supplying the brain. This detail is incredibly important, because when a clot forms inside diseased arteries, it can travel. Sometimes the clot temporarily lodges inside the artery feeding the eye. Blood flow suddenly decreases. The retina becomes oxygen deprived. Vision darkens. Then, if the clot shifts position or dissolves slightly, circulation returns, vision comes back. The patient feels relieved, but biologically, something extremely dangerous just happened. A clot capable of blocking circulation already exists inside the vascular system, and next time, its destination may be different. Imagine a small rock tumbling through a river system. One moment, it briefly catches against a narrow branch. Then water pressure pushes it loose again. But downstream lies a much larger channel leading directly into critical structures. That is similar to how unstable clots behave inside diseased arteries. And this is why temporary blindness in one eye can become such an important stroke warning sign. Doctors sometimes describe this phenomenon with a phrase that sounds almost poetic: a curtain descending over vision. Patients often describe it exactly that way: a shadow, a dark veil, a gray curtain moving downward. Sometimes lasting only seconds, sometimes close to a minute, then completely disappearing. Now here is something deeply unsettling. The symptom may feel temporary, but the underlying vascular disease is not temporary. The artery walls may already contain unstable plaques. Inflammation may already be advanced. Blood flow may already be critically compromised. The eye simply becomes the first visible alarm system. And once again, we encounter the dangerous psychology of recovery. The human brain is strongly influenced by symptom resolution. When pain disappears, fear decreases. When vision returns, urgency fades. People naturally want to believe temporary improvement means safety. But transient recovery after reduced blood flow can actually indicate an unstable vascular condition approaching catastrophe. This is especially dangerous because temporary visual loss often happens without pain. No dramatic suffering, no obvious injury, just sudden darkness, then recovery. Easy to ignore, easy to rationalize, especially in a world where people already spend enormous amounts of time staring at screens. Modern life provides endless excuses: fatigue, stress, sleep deprivation, eye strain, too much phone use, too much computer work. So the warning becomes psychologically hidden inside normal daily discomfort. And meanwhile, the blood vessels continue deteriorating silently. Now let us follow the process even deeper. Inside healthy arteries, blood flows smoothly across a slick inner surface called the endothelium. This delicate lining helps regulate circulation and prevents inappropriate clot formation. But over many years, high blood pressure, smoking, diabetes, inflammation, high blood sugar, and cholesterol accumulation damage this inner lining. The surface becomes rougher, less stable, more vulnerable. Fatty plaques gradually develop. Some plaques become hardened, others remain fragile and unstable. Tiny fragments can break loose unexpectedly. Platelets begin clumping around damaged regions. Small clots form, and these clots may travel upward toward the brain and eyes. This entire process often develops silently for years before the first symptom appears, which means temporary visual loss is rarely an isolated event. It is usually evidence of a deeper vascular problem already progressing beneath the surface. And here is where the situation becomes truly frightening. The clot that briefly blocked circulation to the eye may only be millimeters away from entering major brain arteries. Millimeters. That is all. A tiny shift in pathway could determine whether someone experiences temporary vision loss or permanent paralysis, whether they recover fully or lose speech forever, whether they continue living independently or require lifelong care. This is one reason neurologists react so aggressively to transient visual symptoms affecting one eye. Because they understand the vascular geography involved, the eye is not isolated from stroke risk. It is directly connected to it. Now imagine another scenario. A person experiences temporary blindness while driving. The symptom lasts only 20 seconds. Vision returns. They continue driving home. They tell nobody. 2 days later, a clot fully blocks a major cerebral artery during sleep. The patient wakes unable to move one side of the body. Family members panic. Emergency services are called. And suddenly, everyone realizes that the earlier visual episode was not random at all. It was the warning, the final warning. And this leads us into another uncomfortable truth about human behavior. People often take visible injuries more seriously than invisible vascular symptoms. A broken bone creates immediate concern. Bleeding creates immediate concern. But transient neurological symptoms feel abstract, difficult to interpret, easy to dismiss, especially when recovery occurs quickly. But the brain does not send random interruptions lightly. Temporary loss of function almost always means something physiological disrupted normal neural activity. And blood flow interruption remains one of the most dangerous causes. Now here is another fascinating detail. The retina consumes tremendous energy relative to its size. Just like the brain, it depends heavily on oxygen, which means even small reductions in circulation can create dramatic symptoms quickly. This is why visual changes often become one of the earliest detectable signs of vascular instability. The retina simply cannot tolerate oxygen deprivation very long. And because vision is so central to human experience, even brief interruptions feel emotionally disturbing. Many patients remember the exact moment vividly: the sudden darkness, the panic, the confusion, then the strange relief when vision returns. But what they often do not realize is that relief should not end the medical urgency. It should begin it. Because transient vision loss may represent an unstable clotting situation that remains active. An unstable vascular disease rarely stays quiet forever. Now remember the larger pattern emerging throughout this discussion. The body often warns before catastrophe, brief dysfunction before permanent injury, temporary symptoms before irreversible damage. The challenge is recognizing those warnings while intervention is still possible, and visual symptoms are only one category, because sometimes, instead of darkness affecting the eye, the warning begins somewhere else entirely: in the face, in the arm, in the strange sensation of half the body suddenly no longer feeling fully connected. There is a moment that terrifies neurologists more than most people realize. Not because it always looks dramatic, but because it often looks ordinary. A person is sitting at dinner, holding a spoon, listening to conversation, and suddenly something feels wrong on one side of the body. The fingertips begin tingling, the lips feel strange, part of the face becomes numb. An arm suddenly feels disconnected, heavy, unfamiliar. Sometimes the sensation spreads down one side like invisible electricity moving beneath the skin. Then after several minutes, everything returns to normal. And once again, the person tells themselves the same comforting lie: I probably slept wrong. Maybe a nerve got compressed. Maybe I'm just exhausted. Maybe circulation was poor for a moment. But what if that strange sensation was not happening in the arm at all? What if the real problem was happening inside the brain? Tonight, we continue deeper into the hidden warning system of stroke, because one of the most important clues the brain sends before catastrophe often appears as sudden numbness affecting only one side of the body. And shortly after that, another terrifying symptom may appear: loss of balance, sudden instability, a feeling of walking like a drunk person despite being completely sober. These symptoms seem different on the surface, but deep inside the nervous system, they are connected by the same dangerous mechanism: temporary interruption of blood flow. And once again, we return to the questions running silently beneath this entire discussion. Why does the brain fail in such specific ways? Why do temporary symptoms vanish before major stroke arrives? And why do people repeatedly ignore signs that may predict life-changing neurological injury? To answer those questions, we first need to understand something extraordinary about the organization of the human brain. Your brain is divided into two hemispheres, left and right, and remarkably, each hemisphere primarily controls the opposite side of the body. The left hemisphere controls much of the right side. The right hemisphere controls much of the left side. This crossing system is one of the reasons stroke symptoms often appear on only one side. If blood flow becomes interrupted inside one hemisphere, the opposite side of the body may suddenly lose normal sensation or movement. That is why sudden, one-sided numbness always deserves serious attention, especially when it appears abruptly, especially when no obvious mechanical explanation exists. Now compare this to something harmless and familiar. Imagine falling asleep with your arm trapped beneath your body. You wake up and the arm feels numb. Pins and needles, temporary tingling. In that situation, the problem happens locally. Pressure compresses nerves and blood vessels in the arm itself. When you change position, circulation improves, the nerves recover, the symptom fades. But stroke-related numbness works very differently. The arm itself may be perfectly healthy. The nerves inside the arm may be completely intact. The real problem exists inside the sensory regions of the brain. Blood flow temporarily decreases to the neural circuits responsible for interpreting sensation from that side of the body. The brain stops processing information correctly. And suddenly the body feels strange, disconnected, weak, numb. Sometimes patients describe the sensation as heaviness rather than true numbness. Others describe burning, tingling, loss of coordination, or an eerie feeling that one side no longer belongs to them normally. These descriptions vary because the brain regions affected can differ slightly from person to person, but the pattern remains critically important. Sudden onset, one-sided involvement, temporary neurological dysfunction, then recovery. Exactly the kind of sequence transient ischemic attacks often produce. Now here is another detail many people miss. Stroke-related numbness does not always involve complete paralysis. In fact, early warning episodes may appear surprisingly subtle. A coffee cup suddenly feels difficult to hold. A phone slips unexpectedly from the hand. Buttons become harder to fasten. Facial muscles feel slightly uneven. One side of the mouth tingles strangely. The person may still walk and speak, which makes them underestimate the danger. But neurologically, even mild asymmetrical symptoms can signal unstable circulation inside the brain. And the temporary nature of the symptom creates yet another psychological trap. Recovery encourages denial. Humans are deeply biased toward believing danger disappears when symptoms disappear. But vascular instability can fluctuate. Blood flow may improve briefly, then worsen again later. The clot may partially dissolve, then reform. Pressure changes may temporarily restore circulation before another interruption occurs. So recovery does not necessarily mean safety. Sometimes it simply means the disaster has been delayed. Now let us move to another warning sign that often terrifies patients when it happens. Sudden loss of balance. Not ordinary dizziness. Not mild lightheadedness after standing too quickly. Something much stranger. A person stands up and suddenly cannot walk straight. The room feels violently unstable. The legs feel disconnected from coordination. They drift sideways unexpectedly. They collide with walls. They grab furniture to avoid falling. Some describe it as feeling instantly drunk despite not drinking alcohol. Others describe an overwhelming spinning sensation so intense they cannot remain upright. And once again, many people immediately misinterpret the symptom. Maybe it is exhaustion, maybe low blood pressure, maybe an inner ear problem, maybe vertigo, maybe weakness from overwork. But sometimes, the real cause lies deep inside the back of the brain, inside a structure called the cerebellum. The cerebellum acts like a master coordination center. It constantly fine-tunes balance, posture, precision, and movement. Every step you take depends partly on its calculations. Every adjustment that keeps you upright relies on cerebellar processing. And just like all brain tissue, the cerebellum depends on continuous blood supply. When circulation becomes interrupted, coordination begins failing rapidly. This creates one of the strangest experiences in neurology. The muscles themselves may remain strong, but the body can no longer organize movement correctly. Walking becomes chaotic. Balance collapses. Direction feels distorted. And because the cerebellum sits near structures involved in spatial orientation and vestibular function, patients may also experience severe vertigo and nausea. Now here's why this becomes especially dangerous. Cerebellar strokes are sometimes harder for ordinary people to recognize. There may be no dramatic facial droop initially, no obvious paralysis. Instead, the person simply looks dizzy and unstable. Friends or family may assume they are dehydrated, sleep deprived, or suffering from a harmless balance disorder. Meanwhile, blood flow to critical brain tissue may already be failing, and this creates one of the most dangerous misunderstandings in stroke medicine. Not all strokes look dramatic at first. Some begin quietly, subtly, almost invisibly, until suddenly they are no longer reversible. Now think carefully about something important. Balance is one of the most complex neurological tasks humans perform. To remain upright, the brain must integrate information from vision, inner ear structures, muscles, joints, and spatial processing systems simultaneously. The cerebellum helps synchronize all of this in real time. The fact that humans walk effortlessly most of the day is actually an astonishing neurological achievement, which means when balance suddenly collapses without explanation, doctors pay attention, especially when symptoms appear abruptly, especially when the person cannot walk normally despite trying, especially when the episode resolves mysteriously afterward. Because once again, temporary dysfunction may represent temporary oxygen deprivation. And oxygen deprivation inside the brain is never something to casually ignore. Now notice the larger pattern emerging across all these warning signs. The brain rarely fails randomly. Specific symptoms often reflect specific brain regions losing blood supply temporarily. vision changes, sensory changes, balance problems, language disturbances. Each symptom acts like a map pointing toward vulnerable circulation. The challenge is recognizing the map before permanent injury occurs. And tragically, many patients do not, because modern life trains people to normalize exhaustion, to push through symptoms, to delay medical care, to explain away warning signs, especially when symptoms disappear quickly. But neurons do not care about denial. Blood vessels do not care about optimism. Plaques continue progressing silently, regardless of whether someone chooses to acknowledge them. And sometimes, the next symptom becomes even harder to ignore, because instead of numbness or imbalance, the brain suddenly loses one of the abilities most central to human identity itself: language. There is a moment during certain strokes that patients later describe as more terrifying than pain itself, not because something hurt, but because something fundamental suddenly disappeared. The ability to speak, or even stranger, the ability to understand language. Imagine sitting across from someone you love. They are talking normally. You hear their voice clearly. But suddenly, the words stop making sense. You recognize the sound of speech, yet meaning dissolves completely. Or imagine the opposite. You know exactly what you want to say. The sentence exists perfectly inside your mind, but when you try to speak, the words will not come out correctly. Your mouth moves, your tongue struggles, sounds become broken, disconnected, slurred, and somewhere deep inside, panic begins rising. Because for the first time, you realize the machinery of language itself can fail. Tonight, we enter one of the most disturbing warning signs the brain can produce before major stroke: sudden language disturbance, a symptom that reveals something extraordinary about the structure of the human brain. Because language is not stored in a single place. It is built through specialized networks working together with astonishing precision. And when blood flow temporarily fails inside those networks, human communication itself begins collapsing in real time. Now think carefully about something. Language feels effortless. You hear words, interpret meaning, build sentences, control muscles of the mouth and tongue, organize grammar, retrieve memories, all within fractions of a second. Most people never stop to appreciate how biologically miraculous this process really is. Every conversation depends on billions of neurons firing in coordinated patterns. And like every other brain system we have discussed, those neurons depend entirely on uninterrupted oxygen delivery. The moment blood flow drops, language circuits become vulnerable. And unlike some other stroke symptoms, language disturbances are often emotionally shocking both for patients and families, because speech is tied directly to identity, to thought, to social connection, to the feeling of being mentally present. So when language suddenly fractures, the experience feels deeply unnatural, almost surreal. Now here is where the story becomes fascinating neurologically. Different regions of the brain control different aspects of language. Two of the most important are called Broca's area and Wernicke's area. And understanding these regions helps explain why stroke-related language problems can appear in dramatically different ways. Let us begin with Broca's area. This region helps organize speech production. It transforms thoughts into spoken words. It coordinates the motor planning necessary for clear verbal expression. When blood flow decreases in this area, something strange happens. The person often still understands language. They know what others are saying. They know exactly what they want to communicate, but they cannot properly produce the words. Imagine being trapped behind a damaged microphone. The message exists internally, but the output system malfunctions. Patients may struggle to form sentences. Speech becomes slow, broken, slurred, effortful. Some can produce only short fragments. Others become stuck, repeating partial sounds. You may ask them a simple question, and watch frustration flood their face as they fight to answer, because inside their mind, the answer is clear. But the neural pathway translating thought into speech is failing. Now pause and think about how terrifying that must feel, to remain mentally aware, yet lose control over verbal expression. Many stroke survivors later describe intense panic during these moments, not only because communication breaks down, but because they suddenly realize something is happening inside the brain itself. Now here is another critical detail. Family members sometimes mistake these symptoms for confusion or emotional distress, But Broca-related speech impairment is not simply nervousness. It is neurological dysfunction caused by reduced blood flow. And once again, the timing matters enormously. If circulation returns quickly enough, the language impairment may partially or completely improve. The patient suddenly begins speaking more normally again, and tragically, that improvement may cause everyone to relax. But as we have seen repeatedly throughout this discussion, temporary recovery does not necessarily mean danger has passed. Sometimes it means the brain narrowly escaped permanent injury. Now let us move deeper into the second major language region, Wernicke's area. This part of the brain helps interpret language and organize meaningful communication. When circulation fails here, the situation becomes even stranger. Because patients may continue speaking fluently, words continue flowing, sentences remain smooth, the rhythm of speech sounds almost normal. But the actual content becomes confused or meaningless. The person may substitute incorrect words, invent strange phrases, answer questions inappropriately, or fail to understand simple instructions. Family members often become alarmed immediately because the conversation suddenly feels bizarre. It is not merely slurred speech, it is disruption of meaning itself. Imagine hearing someone speak clearly, yet nothing they say makes logical sense. Or imagine hearing familiar words, but being unable to interpret their meaning properly. This can happen when blood flow becomes interrupted in language comprehension centers. And because patients with Wernicke-type dysfunction may not fully recognize their own impairment, the situation can become even more dangerous. Some individuals insist they are speaking normally despite obvious abnormalities. Others become irritated because they cannot understand why communication suddenly feels chaotic. Now remember one of the major questions guiding this entire discussion. Why do stroke symptoms often appear so specifically? Because the brain is highly specialized. Different regions perform different tasks, and blood flow problems reveal those specializations dramatically. A stroke affecting motor areas creates weakness. A stroke affecting visual systems creates visual disturbance. A stroke affecting language networks disrupts speech and comprehension. The symptom becomes a map of the injured brain region. And language symptoms are especially important because they often appear suddenly and unmistakably. One moment communication is normal, the next moment it is not. No gradual transition, no slow decline, just abrupt neurological failure. This sudden onset is one of the biggest clues that something vascular may be happening, especially when symptoms partially resolve afterward. Now imagine this scene. A man is eating breakfast with his family. He suddenly reaches for water and tries saying something simple, but the sentence comes out distorted. His wife looks confused. He tries again. Now the words sound broken. He becomes frustrated. 30 minutes later, speech improves. The family decides he is probably exhausted, maybe stressed, maybe dehydrated. No one goes to the hospital. The next morning, a major stroke strikes during sleep. This pattern happens far more often than many people realize. Because transient language disturbances are among the classic warning signs of temporary brain ischemia, and yet they are still commonly dismissed, especially when symptoms disappear quickly. People often assume true neurological emergencies must be dramatic and permanent immediately. But the brain does not always fail that way. Sometimes it whispers before it screams, and language disturbances can become one of those whispers. Now here is something else fascinating. Speech problems caused by stroke are usually different from ordinary forgetfulness. Everyone occasionally struggles to remember a name. Everyone occasionally loses a word during stress or fatigue. That is normal, but stroke-related language dysfunction often feels qualitatively different, abrupt, abnormal, disconnected from ordinary mental lapses. The person may suddenly become unable to repeat simple phrases, unable to name familiar objects, unable to follow ordinary conversation, or unable to physically coordinate speech despite clear understanding. These patterns matter enormously clinically because they suggest interruption of brain function rather than simple distraction or tiredness. And once again, time remains critical. The longer blood flow remains unstable, the greater the risk of permanent neuronal death, which means early recognition becomes everything. Now notice how the body continues revealing the same terrifying pattern across all these warning signs. Temporary blindness, temporary numbness, temporary imbalance, temporary language disruption. Again and again, the brain briefly loses function, then recovers, as if giving warning after warning before catastrophe finally arrives. But there is another signal we still have not fully explored, a warning sign many people rarely associate with stroke risk at all, because it begins not with movement, not with speech, but with inflammation quietly spreading through the blood vessels themselves. Most people imagine stroke beginning with a blood clot, or high blood pressure, or cholesterol, but sometimes the process starts much earlier, much deeper, inside the immune system itself. And tonight we arrive at one of the most misunderstood pieces of the entire puzzle, because before arteries become blocked, before clots fully form, before neurons begin dying, something may already be quietly damaging the blood vessels from within. Inflammation, slow, persistent, invisible inflammation. And in some people, the first clues appear not in the brain, but on the skin. Imagine noticing pale white patches slowly appearing across parts of the body, areas where normal skin color disappears. Many people recognize this condition immediately. Vitiligo, a disorder often dismissed as purely cosmetic, a skin condition, nothing more. But what if those white patches was really something happening far beyond the skin itself? What if the immune system attacking pigment cells was also capable of damaging blood vessels? And what if unusual headaches appearing during that process were not random at all, but warnings that inflammation inside the vascular system was beginning to affect circulation to the brain? Tonight, we explore one of the most fascinating and unsettling ideas in modern vascular medicine, the possibility that chronic immune dysfunction and inflammation may quietly help prepare the conditions for future stroke. Now remember the larger questions guiding everything we have discussed. Why do blood vessels slowly become unstable? Why do warning signs appear before catastrophic stroke? And why do some symptoms seem disconnected from the brain at first glance? This part of the story begins answering those questions in a completely different way. Because stroke is not always just a plumbing problem, it is also a biological environment problem. And the immune system plays a much larger role in that environment than most people realize. To understand this, we first need to understand the inner lining of blood vessels. Inside every healthy artery exists an extraordinarily delicate surface called the endothelium. This layer is incredibly thin, almost unimaginably thin. Yet it performs essential tasks every second of your life. It helps regulate blood flow, controls clotting behavior, maintains smooth circulation, signals blood vessels when to tighten or relax. And perhaps most importantly, healthy endothelium creates a slick, friction-resistant surface that prevents dangerous buildup inside arteries. In a healthy system, blood cells glide across this lining smoothly, almost effortlessly. But when inflammation damages the endothelium, everything begins changing. The smooth surface becomes irritated, rough, unstable, tiny injuries develop. The immune system becomes more active. Inflammatory molecules increase. And slowly, the artery transforms from a smooth channel into a vulnerable environment where plaque formation becomes easier. Now, this is where autoimmune disease enters the picture. An autoimmune condition occurs when the immune system mistakenly attacks the body's own tissues. Instead of recognizing healthy cells as friendly, the immune system behaves as though they are threats. In vitiligo, immune cells target melanocytes, the pigment-producing cells responsible for skin color. That is why pale white patches appear. But researchers increasingly recognize that autoimmune activity rarely remains perfectly isolated. Inflammation can affect multiple systems simultaneously, including blood vessels. And when vascular inflammation develops, the consequences can become extremely dangerous over time. Imagine sandpaper scraping repeatedly across the inner walls of arteries. That is somewhat similar to what chronic inflammation does biologically. The endothelial lining becomes irritated and damaged, microscopic scars form, repair mechanisms activate repeatedly, and damaged regions become ideal locations for cholesterol particles and platelets to accumulate. This is one of the key moments in the birth of atherosclerosis, the gradual formation of arterial plaque. Now think carefully about how frightening this process really is. The body may spend years slowly damaging its own circulation without producing obvious symptoms. No pain, no alarms, no dramatic warning, just quiet inflammation altering blood vessels day after day. Then eventually, the first visible neurological symptoms appear: transient vision loss, numbness, speech difficulty, balance problems. By the time those signs emerge, the vascular disease may already be advanced. And this leads us to another question many people never consider. Why would headaches matter in this discussion? Because blood vessels and inflammation often influence headache patterns, especially when headaches appear in unusual ways. Now, let us be very careful here. Not every headache means stroke risk. Most headaches are not caused by dangerous vascular disease. Fatigue, stress, sleep deprivation, dehydration, migraine disorders, all can produce headache symptoms. But physicians become concerned when certain patterns suddenly change, especially in individuals already showing signs of systemic inflammation or autoimmune activity. For example, a person with vitiligo begins experiencing severe headaches unlike anything they have had before. Persistent headaches, new headaches, headaches with unusual intensity, headaches that continue abnormally. This does not automatically mean stroke is occurring, but it may signal that deeper vascular inflammation deserves investigation. Because inflamed blood vessels behave differently from healthy vessels, their walls become more reactive, more unstable, more vulnerable to plaque development and clot formation. And over years, that instability may increase the risk of interrupted circulation to the brain. Now, here is something important many people misunderstand about stroke risk. They imagine dangerous arteries only happen to people with extremely high cholesterol. But vascular disease is far more complicated than simple cholesterol numbers. The condition of the artery wall itself matters enormously. A mildly elevated cholesterol level inside healthy vessels may be less dangerous than severe endothelial inflammation with moderate cholesterol. Because plaque formation depends heavily on where cholesterol particles can stick and accumulate. Inflammation creates those vulnerable surfaces. And once plaque begins forming, the process often accelerates. Platelets gather, immune cells infiltrate the area, fibrous caps develop, calcium deposits may appear. The artery gradually stiffens and narrows, all while the person continues daily life completely unaware. Now pause for a moment and consider how interconnected the human body truly is. A skin disorder, an immune response, inflammation inside microscopic vessel linings, changes in clotting behavior, plaque formation, reduced blood flow to the brain. At first, these seem unrelated, but biologically, they may belong to the same chain reaction unfolding slowly over years. This is one reason modern medicine increasingly views vascular disease as an inflammatory process rather than merely a cholesterol storage problem. Inflammation changes the behavior of arteries themselves, and chronic inflammation rarely stays harmless forever. Now let us return briefly to the emotional reality of unusual headaches. One of the reasons headaches become so difficult to interpret is because nearly everyone experiences them occasionally. Humans are conditioned to normalize head pain. People continue working, driving, scrolling through phones, ignoring symptoms, especially when headaches come and go. But sudden changes in headache patterns deserve attention, particularly when combined with other neurological symptoms. Vision changes, numbness, speech abnormalities, balance disturbances. These combinations matter because the brain and blood vessels operate as an integrated system, and warning signs rarely exist completely isolated from one another. Now remember another important pattern we keep encountering. The body often whispers before it screams. Subtle inflammation before major blockage, temporary symptoms before permanent injury, minor dysfunction before catastrophic stroke. The tragedy is that many people interpret temporary improvement as proof of safety, but inflammation can continue silently even when symptoms temporarily calm down. The vascular system may remain unstable beneath the surface, and this instability becomes even more dangerous when combined with two enormous forces damaging arteries across the modern world: chronically elevated blood sugar and cigarette smoke, two silent destroyers capable of accelerating vascular injury year after year without obvious symptoms at first, and together, they create conditions where stroke risk begins climbing far earlier than many people realize. Long before a major stroke happens, long before an ambulance arrives, long before a person collapses on the floor unable to speak, the destruction usually begins in silence, not over days, not over weeks, but over years. Tiny injuries accumulating inside blood vessels hour after hour, meal after meal, cigarette after cigarette, until one day the brain can no longer compensate. And this is where we uncover one of the most dangerous illusions in modern health. Many people believe stroke arrives suddenly, as if disaster appears out of nowhere. But biologically, most strokes are the final chapter of a process that has been unfolding quietly for decades. Tonight we enter that hidden process. And at the center of it are two of the most powerful vascular destroyers in the modern world: chronically elevated blood sugar and cigarette smoke. Two forces capable of slowly transforming healthy arteries into unstable pathways vulnerable to blockage and clot formation. Now think about something remarkable. Your blood vessels are not rigid plastic tubes. They are living tissue, flexible, responsive, delicate. Every second they must expand, contract, regulate pressure, control clotting, and maintain smooth circulation through billions of microscopic pathways. To do this successfully, the inner lining of those vessels must remain healthy, smooth, elastic, intact. But what happens when the bloodstream itself becomes chemically hostile day after day? This question brings us directly into the story of blood sugar and insulin resistance. Now, here's one of the biggest misconceptions many people carry. They believe blood sugar becomes dangerous only after someone is officially diagnosed with diabetes. But vascular injury often begins years earlier, sometimes long before laboratory numbers cross the threshold of formal disease. And the process can begin with something that feels completely ordinary: daily eating habits, highly refined carbohydrates, sugary drinks, constant snacking, sweetened coffee, processed foods rapidly converted into glucose, foods that flood the bloodstream with sugar again and again throughout the day. Now, glucose itself is not evil. The brain actually depends heavily on glucose for energy. Every cell in the body needs fuel. The problem begins when the system becomes overloaded continuously, because every time blood sugar rises, the pancreas releases insulin. Insulin acts like a key. It helps move glucose from the bloodstream into cells. Under healthy conditions, this system works beautifully. But imagine forcing the system to handle large sugar spikes repeatedly for years. Eventually, the cells begin responding less effectively. The body compensates by producing even more insulin. And slowly, insulin resistance develops. Now, this is where the danger deepens. Because glucose remains elevated in the bloodstream longer than it should, and excess sugar circulating through arteries becomes biologically destructive. Remember the endothelial lining we discussed earlier? That thin protective surface inside the blood vessels? Chronically elevated glucose damages it directly. The injury happens microscopically at first. Tiny disruptions, inflammatory stress, chemical instability. The once smooth vessel wall begins deteriorating. Some endothelial cells lose function, others become inflamed. The surface grows rougher, less elastic, more vulnerable. And once that protective lining becomes damaged, the artery changes character entirely. Now cholesterol particles can stick more easily. Platelets begin adhering to injured regions. Inflammatory cells accumulate. Plaque formation accelerates. This is how atherosclerosis quietly begins evolving. Not as a sudden event, but as a slow biological erosion happening silently year after year. Now imagine this process occurring across the arteries feeding the brain. At first, the narrowing is mild, no symptoms, then moderate, still no symptoms. The brain compensates remarkably well for a long time, but eventually circulation becomes fragile. And this is when transient ischemic attacks may begin appearing. Brief numbness, temporary speech problems, short episodes of vision loss, moments of imbalance. The brain starts sending warnings, but many people never connect those symptoms to blood vessel disease developing over decades. Now pause and think about how deceptive this process really is. Someone may feel mostly healthy, still working, still active, still functioning normally. Meanwhile, the vascular system may already contain unstable plaque waiting for the wrong moment. This is why stroke prevention is not only about treating emergencies. It is about understanding slow damage before catastrophe occurs. And one of the greatest accelerators of that damage is chronic insulin resistance. Now, here is another frightening detail. Insulin resistance affects more than blood sugar alone. It also influences inflammation, blood pressure regulation, fat metabolism, and clotting behavior. the entire cardiovascular environment becomes more dangerous, which means stroke risk often rises long before someone experiences obvious diabetic symptoms. This is one reason modern medicine pays such close attention to metabolic health. Because damaged metabolism gradually damages circulation, and damaged circulation eventually threatens the brain. But as destructive as elevated blood sugar can become, there is another vascular toxin that attacks arteries even more aggressively in many cases: cigarette smoke. Now, most smokers already know smoking harms health, but many still imagine the damage primarily affects the lungs. What they often do not realize is how violently cigarette smoke affects blood vessels themselves. Every inhalation introduces thousands of chemicals into the body: nicotine, carbon monoxide, oxidative toxins, inflammatory compounds. These substances travel directly through the bloodstream, and the vascular system absorbs the consequences immediately. Remember the smooth endothelial lining protecting healthy arteries? Smoking attacks that lining relentlessly. Inflammation increases. Oxidative stress rises. Repair mechanisms become overwhelmed. The vessel wall loses stability. But smoking does not stop there. It also changes the blood itself. Nicotine stimulates stress responses throughout the body. Blood vessels constrict, heart rate rises, blood pressure fluctuates. Meanwhile, carbon monoxide reduces oxygen delivery efficiency, and perhaps most dangerously, smoking increases platelet stickiness. Now think carefully about why this matters. Platelets help blood clot during injury. That is normally protective. But inside damaged arteries, overactive platelets become dangerous because they increase the likelihood of clot formation exactly where plaques already exist. Imagine combining three conditions simultaneously. First, an inflamed artery wall. Second, rough plaque surfaces narrowing circulation. Third, stickier blood more likely to clot. This combination creates a perfect environment for ischemic stroke. One unstable plaque ruptures. A clot forms rapidly. Blood flow to the brain suddenly stops, and within minutes, neurons begin dying. Now remember something terrifying about smoking-related vascular damage. It accumulates gradually. A smoker rarely feels arteries hardening in real time. No alarm sounds. No pain announces plaque formation. The process unfolds invisibly, which makes the illusion of safety incredibly seductive, especially in younger adults. Many smokers assume stroke belongs only to old age, but vascular injury can begin surprisingly early, and smoking dramatically accelerates it. Research consistently shows smokers face substantially higher stroke risk compared with non-smokers. In some populations, the risk may rise between 2 and 4 times higher, depending on smoking intensity and additional health factors. Now combine smoking with insulin resistance, or hypertension, or chronic inflammation, and the vascular system enters extremely dangerous territory. Because these risk factors amplify one another, they do not merely add together. They interact, each one worsening the biological environment inside arteries, and all of them quietly increase the likelihood of future blockage inside the brain. Now think back to the warning signs we explored earlier: temporary blindness, numbness, speech disturbances, balance problems. Those symptoms do not emerge randomly. They are often the visible surface of years of hidden vascular injury finally becoming unstable. And this is why prevention matters so profoundly. Because by the time major stroke occurs, the underlying disease process may already be advanced. But there is another factor many people misunderstand completely: blood pressure, especially what happens to blood pressure during sleep. Because surprisingly, some of the most dangerous moments for stroke may occur not during stress or activity, but during the quietest hours of the night. There is a reason so many stroke stories begin the same way. A person goes to bed feeling mostly normal, maybe a little tired, maybe with mild dizziness earlier in the evening, maybe after ignoring strange symptoms for days or weeks. Then sometime between deep night and early morning, everything changes. A spouse wakes up and notices slurred speech. An arm no longer moves. One side of the face droops, or the person wakes confused, unable to stand properly. Again and again, hospitals around the world see the same pattern: major strokes appearing during the final hours of sleep, or immediately after waking. And at first glance, this seems strange. Shouldn't stroke happen during stress? During physical exertion? During emotional shock? Why would the brain fail while the body is resting quietly? Tonight, we uncover one of the most fascinating and misunderstood mechanisms in stroke medicine. Because the danger is not always extreme blood pressure itself. Sometimes the danger is what happens when blood pressure falls, inside arteries already critically narrowed. Now remember the larger mystery we have been following throughout this journey. Why do temporary warning signs appear before catastrophic stroke? Why does the brain sometimes survive reduced circulation briefly, then suddenly fail later? And why do so many people experience stroke near dawn? To answer this, we need to understand something. The body does automatically every single night. Blood pressure naturally decreases during sleep. This is normal physiology, healthy physiology. As the body rests, stress hormones decline, heart rate slows, the nervous system shifts into recovery mode, and blood pressure typically drops by roughly 15 to 20% compared with daytime levels. For healthy arteries, this is not dangerous. The vascular system adjusts easily. Blood continues flowing smoothly through open vessels. The brain receives enough oxygen. Everything functions normally. But now imagine a very different situation. Imagine an artery supplying the brain has already been narrowed significantly by plaque. Not fully blocked, just narrowed enough that circulation has become fragile. During daytime, higher blood pressure may still force enough blood through that narrowed opening to keep brain tissue alive. The system survives by compensation, barely. But then night arrives. Blood pressure begins falling naturally during sleep. And suddenly, the weakened flow through that narrowed artery drops below a critical threshold. Now circulation becomes dangerously slow. Imagine water moving through a pipe almost closed by debris. At high pressure, some water still passes. But reduce the pressure enough, and flow nearly stops entirely. This is essentially what can happen inside diseased cerebral arteries during sleep. And once blood begins slowing dramatically, another threat emerges: clot formation. Because sluggish blood flow creates ideal conditions for platelets and clotting proteins to accumulate, a thrombus may begin forming directly inside the narrowed vessel, or unstable plaque may rupture under vascular stress. Then suddenly, the artery becomes fully blocked, and somewhere deep inside the brain, neurons begin dying, quietly, silently, while the person remains asleep. Now pause for a moment and think about how frightening this really is. The body's normal nightly recovery process, the very process designed to help us heal, can become dangerous when blood vessels are already diseased. This is why many neurologists pay such close attention to early morning stroke patterns, because those patterns often reveal severe underlying vascular narrowing already existed long before the emergency occurred. Now let us follow a hypothetical patient through this process. A man in his late 50s has hypertension for years. He occasionally smokes. His diet contains heavy refined carbohydrates and sugary drinks. He has brief episodes of dizziness sometimes. A few moments of numbness in his hand weeks earlier. Occasional speech hesitation he blamed on fatigue. Nothing dramatic enough to seek emergency care. Meanwhile, plaque inside his carotid artery gradually grows, 70% narrowing, maybe more. But he still functions normally because daytime blood pressure keeps enough blood moving through the vessel. Then one night, blood pressure naturally declines during deep sleep. Circulation through the narrowed artery slows critically. A clot forms. At approximately 3 in the morning, part of the brain loses oxygen supply completely. When he wakes at dawn, his speech is slurred. His right arm does not respond normally. The major stroke did not truly begin that morning. Biologically, it began years earlier. Now here is one of the most important ideas in this entire discussion. High blood pressure is dangerous. Absolutely. Chronically elevated pressure damages vessel walls, accelerates plaque formation, and increases stroke risk significantly. But many people misunderstand the deeper issue. The true danger often lies in the condition of the arteries themselves. Narrowed vessels create vulnerability. Unstable plaque creates vulnerability. Inflamed endothelium creates vulnerability. Because once arteries lose healthy flexibility and openness, even normal physiological changes can become dangerous, including nighttime blood pressure reduction. This explains why some individuals with only moderately elevated blood pressure still suffer major strokes, while others with higher numbers do not. The structure and stability of the vascular system matters enormously. Now think carefully about something else. Many people only monitor blood pressure during moments of stress or headache, but vascular disease develops continuously, even during sleep, even during quiet hours, and in some patients, blood pressure regulation itself becomes abnormal. Some experience excessive nighttime blood pressure drops. Others have poorly controlled hypertension, damaging vessels continuously. Still others combine hypertension with diabetes, smoking, inflammation, obesity, or atrial fibrillation. Each additional factor increases instability inside the vascular system. Now remember the recurring theme throughout this podcast. The body often sends warnings before catastrophe, and those warnings frequently appear during unstable circulation states. Morning dizziness, brief weakness after waking, temporary speech abnormalities, sudden imbalance getting out of bed, short episodes of blurred vision near dawn. These events may represent transient reductions in blood flow during periods when circulation becomes critically vulnerable. But tragically, people often dismiss them, especially if symptoms disappear after a few minutes. Someone drinks coffee, walks around, feels better, and assumes the episode was harmless. Meanwhile, the artery remains dangerously narrowed. Now there is another fascinating detail many people never realize. Certain strokes are actually discovered only because patients wake up already impaired. Doctors sometimes call these wake-up strokes. The exact timing can be difficult to determine because the patient was asleep during onset, but the pattern itself strongly supports the importance of nighttime vascular changes in stroke physiology. And once again, this reveals something profound about the brain. Neurons are extraordinarily dependent on continuous circulation. Even temporary interruption during vulnerable periods may create irreversible injury. Now imagine two different highways supplying a city. One remains wide open. Traffic flows easily even during low-energy nighttime hours. The other is narrowed almost completely by construction and debris. During busy daytime conditions, enough traffic still squeezes through, but reduce overall movement too much, and the system collapses entirely. This is similar to what happens in narrowed arteries during nocturnal blood pressure decline. The problem is not merely pressure itself. The problem is the inability of diseased vessels to maintain reliable circulation under changing conditions. And this leads us directly into one of the most critical moments in stroke prevention. Because once warning signs appear, once transient symptoms begin, there is a narrow window where action may still prevent permanent catastrophe. A window many people tragically waste through dangerous misunderstandings, folk remedies, or delays. And the next decisions made during those first hours may determine whether brain tissue survives or dies forever. There is a moment in stroke medicine that doctors fear more than almost anything else, not the arrival of the patient, not even the severity of the damage, but the sentence families say when they finally reach the hospital. He seemed better at first. Or sometimes, we thought it would pass. And hidden inside those few words is one of the most tragic realities in neurology. Because the first 72 hours after warning symptoms appear may represent the final opportunity to prevent catastrophic brain injury. A temporary episode of numbness, a brief loss of speech, sudden imbalance, short-lived blindness in one eye. Many people experience these signs, recover partially, then go back to normal life. They return to work, go back to sleep, drive home, ignore the event, and meanwhile, the vascular system remains unstable. The clotting risk remains active. The narrowed artery remains dangerously vulnerable. The clock continues moving silently forward. Tonight, we enter the most important practical question of this entire discussion. What should actually happen the moment these warning signs appear? Because recognition alone is not enough. Correct action during those first hours may determine whether the brain survives intact or suffers permanent damage. Now remember the terrifying pattern we have followed again and again. Transient symptoms do not necessarily mean the danger is gone. Sometimes temporary recovery is the final warning before major stroke. This is why physicians treat transient ischemic attacks so seriously, because statistically, the risk of full stroke rises dramatically in the hours and days afterward, especially within the first 72 hours. Think about that carefully. The body may briefly restore circulation, symptoms improve, speech returns, vision clears, balance stabilizes. Yet the underlying vascular problem may still be one unstable clot away from disaster. This is why immediate response matters. And the very first thing a person should do after warning symptoms appear is simple. Tell someone. Immediately. Not tomorrow, not after resting, not after waiting to see if it happens again. A family member, a spouse, a friend. Someone must know what is happening. Because stroke symptoms can worsen suddenly. A person who can still walk and talk now may lose speech or consciousness later, and being alone during that transition becomes extremely dangerous. Now imagine this scenario. A woman experiences sudden numbness in one side of her face while home alone. It fades after 15 minutes. She decides to ignore it. Several hours later, a larger clot forms. Speech collapses. She cannot call for help properly. Precious treatment time disappears. This is exactly why isolation after warning symptoms becomes so dangerous. The brain can deteriorate rapidly once circulation fails completely. Now here is another critical instruction many people ignore. Do not drive yourself to the hospital, even if symptoms seem mild, even if they improve temporarily, because stroke symptoms can fluctuate unpredictably. A person may suddenly lose coordination, vision, speech, motor control. Even briefly losing control behind the wheel can become fatal not only for the patient, but for everyone nearby. And yet many people still attempt to drive themselves because they underestimate what is happening inside the brain. Now let us confront one of the most dangerous problems in emergency stroke care: delay caused by traditional misconceptions and folk remedies. In many communities, especially across parts of Asia, people often interpret early stroke symptoms incorrectly. Dizziness becomes fatigue, weakness becomes poor circulation, facial drooping becomes wind exposure, and instead of activating emergency medical care, families begin home remedies, coin rubbing, oil application, finger bloodletting, massage, herbal treatments, waiting for symptoms to pass naturally. Now, this is extremely important to understand. These methods do not reopen blocked cerebral arteries. They do not stop brain bleeding. They do not restore oxygen delivery to dying neurons. What they often do instead is consume precious time. And in stroke medicine, time is brain. Every minute matters because neurons continue dying while circulation remains impaired. Now, here is another terrifying misconception. Some people immediately give aspirin or blood thinning medication without medical evaluation. They assume all strokes come from clots. But this assumption can become deadly. Remember earlier when we discussed the two major types of stroke? Ischemic stroke involves blocked blood vessels. Hemorrhagic stroke involves ruptured blood vessels and bleeding into the brain. And without imaging, you cannot reliably tell which type is occurring simply by looking at the patient. Now imagine a person suffering hemorrhagic stroke. A vessel inside the brain has ruptured. Bleeding is already expanding inside the skull. Then someone administers blood thinning medication. The bleeding may worsen dramatically. Pressure inside the brain rises further. Neurological damage accelerates. Death risk increases rapidly. This is why emergency imaging matters so profoundly. Doctors must determine what type of stroke is occurring before specific treatments begin. The brain cannot be treated safely through guesswork. Now, while waiting for emergency care, body positioning also matters more than many people realize. The goal is simple: support circulation while protecting the airway and neck alignment. The person should rest on a flat surface. The legs may be elevated slightly above chest level to support circulation. Meanwhile, the head and neck should remain naturally aligned, not sharply bent forward, not excessively tilted backward, because major neck flexion or twisting may potentially affect blood flow through already compromised arteries. And if vomiting or decreased consciousness occurs, airway safety becomes critical. Now think carefully about how strange this situation really is. A person may appear relatively normal externally, while a life-threatening vascular emergency unfolds internally. This is why delays become so common. People expect dramatic collapse immediately. But transient ischemia often begins subtly: speech hesitation, mild imbalance, brief visual loss, temporary weakness, symptoms that feel easy to rationalize away, especially once they improve. But inside the vascular system, the biological danger may still be escalating. Now let us return briefly to the idea of the 72-hour window. Why does this period matter so much? Because unstable plaque and clotting behavior often remain highly active after transient symptoms occur. The first event may only partially obstruct circulation. Then later, the obstruction enlarges, or another clot forms nearby, or blood flow becomes critically reduced during sleep. This is why emergency evaluation after warning symptoms is not overreaction. It is prevention. The goal is to intervene before permanent brain injury develops. Now, here is something deeply emotional many stroke survivors describe afterward: regret. Not only about lifestyle choices, but about ignored warnings. Many later remember episodes that suddenly make sense in hindsight: the strange dizziness, the temporary speech problem, the numbness that disappeared, the visual blackout they dismissed as fatigue. The body was trying to communicate danger, and they did not yet understand the language. That is why education matters. Because recognizing stroke early changes outcomes dramatically. Faster treatment may preserve brain tissue, reduce disability, improve recovery potential, save speech, save mobility, save independence, sometimes even save life itself. But there is still one final piece of this puzzle we have not fully explored. Because prevention does not end with emergency response. Once warning signs appear, the next step is discovering why the vascular system became unstable in the first place. And that requires looking deeper inside the arteries, blood sugar patterns, and heart rhythm itself. Because sometimes the most dangerous threats are the ones silently hiding beneath the surface long before symptoms begin. At the beginning of this journey, we asked 3 questions. Why does the brain often send warning signs before a major stroke? Why do so many people ignore those signals until it is too late? And perhaps most importantly, can catastrophic stroke actually be prevented before permanent damage occurs? Now, after everything we have explored together, the answer becomes clear. In many cases, yes, not always, not perfectly, but far more often than most people realize, because stroke is usually not a lightning strike from nowhere. It is a process, a slow biological story unfolding silently inside blood vessels over many years. And the earlier that story is discovered, the greater the chance of interrupting it before the ending becomes tragic. Tonight we arrive at the final and perhaps most powerful idea of this entire discussion. The goal is not simply surviving stroke. The goal is preventing the brain from ever reaching that point. And prevention begins with seeing what the body is trying to hide beneath the surface. This is why certain medical evaluations become critically important after warning signs appear. Not generic checkups, not vague reassurance, but targeted investigation into the systems most closely connected to stroke risk. The first of these is carotid Doppler ultrasound. Now imagine the arteries in the neck as the brain's main supply highways. These carotid arteries deliver enormous amounts of oxygen-rich blood upward into the cerebral circulation every second. If one of those highways narrows severely, the brain becomes vulnerable, especially during blood pressure changes, clot formation, or unstable plaque rupture. A carotid Doppler ultrasound allows physicians to visualize how blood is moving through these arteries. Not just the structure, but the actual flow dynamics. The speed of circulation, areas of turbulence, points of narrowing. This matters enormously because plaque does not always produce obvious symptoms immediately. Someone may feel relatively normal while a carotid artery quietly becomes critically narrowed. Now think back to the warning signs we discussed earlier: temporary blindness in one eye, brief speech problems, transient numbness, moments of imbalance. Sometimes these symptoms originate from unstable plaque shedding tiny clots upward the brain or retina. And the carotid Doppler study helps reveal whether dangerous narrowing may already exist. Now here is the frightening threshold physicians watch carefully. When carotid narrowing exceeds roughly 70%, stroke risk rises dramatically. At that stage, the question often shifts from, could stroke happen someday? To, how soon might circulation fail completely? This is why identifying severe narrowing early becomes so valuable, because intervention may still be possible before catastrophic brain injury occurs. Now let us move to the second major test, HbA1c. At first glance, this laboratory value may seem less dramatic than brain scans or vascular imaging, but in reality, it reveals one of the deepest long-term drivers of vascular disease: chronic blood sugar exposure. Remember earlier when we explored insulin resistance and endothelial injury? The vascular system does not respond only to occasional glucose spikes. It responds to cumulative exposure over time. And that is exactly what HbA1c measures. Unlike a single fasting glucose test taken one morning, HbA1c reflects average blood sugar patterns across approximately 3 months. Why? Because glucose molecules attach gradually to hemoglobin inside red blood cells. The higher the average glucose exposure, the higher the HbA1c level becomes. This makes the test incredibly useful. A person cannot easily manipulate it through temporary fasting or a few days of careful eating before medical appointments. It reveals longer-term metabolic reality. And this matters because prediabetes often causes vascular damage years before formal diabetes diagnosis occurs. Many individuals walk around with normal-looking fasting glucose levels occasionally, while chronic metabolic dysfunction silently injures arteries every day. HbA1c helps expose that hidden process. It allows earlier intervention, earlier dietary change, earlier metabolic control, earlier vascular protection, and once again, earlier prevention means protecting brain tissue before symptoms become permanent. Now we come to the third important investigation, 24-hour Holter monitoring. This test focuses not on arteries directly, but on the heart itself. Because sometimes the danger does not begin in the neck or inside brain vessels. Sometimes it begins with rhythm, specifically a condition called atrial fibrillation. Now, under healthy conditions, the chambers of the heart contract in coordinated patterns that keep blood moving efficiently. But during atrial fibrillation, the upper chambers begin beating chaotically, irregularly. Instead of smooth contractions, the heart quivers inefficiently, and when blood stops moving smoothly, it tends to stagnate. Pool. Swirl. This becomes dangerous because stagnant blood forms clots more easily. Then one day, a clot may break free from the heart, travel upward through circulation, enter cerebral arteries, and suddenly block blood flow to the brain. This is one of the major mechanisms behind embolic stroke. Now here's the problem. Atrial fibrillation is not always constant. Some patients experience intermittent episodes lasting minutes or hours before returning to normal rhythm. A brief office electrocardiogram might completely miss it. That is why Holter monitoring becomes valuable. The patient wears a portable recording device continuously across an entire day or longer. Meanwhile, the system captures hidden rhythm abnormalities occurring during ordinary daily activity and sleep. And sometimes, this simple monitoring reveals the hidden source behind unexplained stroke symptoms. Now, notice something remarkable about all three evaluations we just discussed. Each one searches for hidden instability before catastrophe occurs. Hidden arterial narrowing, hidden metabolic injury, hidden rhythm disturbance. Because stroke prevention is ultimately about uncovering silent processes early enough to change their direction. And this brings us to the deeper truth behind long-term prevention itself. Prevention is not a single pill, not one test, not one doctor visit. It is the gradual protection of blood vessels over years. Meal by meal, habit by habit, decision by decision. Reducing refined carbohydrates and excess sugar lowers chronic metabolic stress on arteries. Controlling blood pressure consistently helps protect delicate vessel walls from ongoing injury. Completely eliminating cigarette smoking removes one of the most destructive vascular toxins humans routinely expose themselves to. And perhaps equally important, paying attention to the body's warning signs changes everything. Not dismissing them, not minimizing them, not waiting for collapse. A brief episode of numbness matters. Sudden speech disturbance matters. Temporary vision loss matters. Unusual imbalance matters. The body often speaks quietly before emergency arrives. The question is whether we listen in time. Now think back to the beginning of this entire story. So many people imagine stroke as pure bad luck, a random catastrophe, an unavoidable accident. But the reality is often far more complex. Most strokes emerge from years of accumulated vascular damage, years of inflammation, metabolic dysfunction, plaque formation, blood pressure stress, clotting instability. And because those processes develop gradually, there is often an opportunity to intervene, to slow them, sometimes even reverse portions of them, before irreversible brain injury occurs. That may be the most hopeful message in all of stroke medicine. The brain is vulnerable, yes, terribly vulnerable. but many of the systems threatening it are modifiable, and awareness changes outcomes. Tonight, somewhere in the world, someone will ignore temporary numbness. Someone will dismiss sudden dizziness. Someone will explain away blurred vision or strange speech as exhaustion. And somewhere else, another person will recognize those same symptoms and seek help immediately. One decision may alter the course of an entire life. If this conversation helped you understand the hidden warning signs of stroke more clearly, take one small action after this video ends. Talk to someone you love. Ask your parents about their blood pressure. Encourage someone to stop smoking. Schedule the medical evaluation you have been postponing. Or simply remember the warning signs we discussed tonight. Because information becomes powerful only when it changes behavior. And if even one person recognizes a future stroke warning earlier because of what you learned here, that knowledge may one day save a brain, a voice, a memory, or an entire life. If you found this episode valuable, subscribe to the channel and turn on notifications so you do not miss future deep dive health discussions designed to make complex medical science understandable and practical in everyday life. And if you or someone close to you has ever experienced temporary stroke warning signs, leave a comment below sharing your experience. Your story may help someone else recognize danger before it becomes irreversible. Take care of your brain, take care of your blood vessels. And most importantly, do not ignore what your body is trying to tell you.